Hello and welcome to the COMLEX Instant Review podcast. Today we're going to talk about Chapman's points, and the key things you want to understand about Chapman's points are basically that there's anterior and posterior Chapman's points. The anterior ones are smooth, firm, discretely palpable nodules, usually 2 to 3 millimeters in diameter, and they're located in the deep fascia, whereas the posterior ones are located between the spinous and the transverse process of the vertebra. So on a board exam question, you can have a question that talks about posterior tender points with a location between spinous and transverse process of the vertebra. If there's any other location, then it's probably not a Chapman's point. Also, Chapman's reflexes are more for diagnosis than for treatment, and they represent viscerosomatic reflexes. So they represent viscerosomatic reflexes. In other words, they show the somatic manifestations of a visceral dysfunction. And an example can be an appendix that basically is flaring, and you feel a tender point or Chapman's reflex point at the tip of the 12th rib anteriorly, and posteriorly at the transverse process of T11 vertebra. So the adrenals are located at anteriorly 2 inches superior and 1 inch lateral to the umbilicus. Posteriorly, they're between the spinous and the transverse process of T11 and T12. Whereas the kidneys are basically 1 inch superior and 1 inch lateral to the umbilicus, and posteriorly between the spinous and the transverse process of T12 and L1. The bladder is in the periumbilical region. The colon is on the lateral thigh within the iliotibial band from the greater trochanter just above the knee. So these are just some of the very common Chapman's reflex points that you're probably going to see on the boards. Also, the boards likes to ask you questions regarding the sigmoid colon. Understand that to determine what portion of the colon corresponds to a Chapman's reflex, you have to split the colon in the middle of the transverse colon, and again flip each side to the corresponding iliotibial band. So the cecum is located at the right proximal femur, and the proximal transverse colon at the hepatic flexure is located at the right distal femur. So those are the two key Chapman's tender points on the right side. On the left side, you have the sigmoid colon at the left proximal femur, and the distal transverse colon at the splenic flexure is located at the left distal femur. So if you're having a question relating to the cecum, then you're going to think about right proximal femur. If it's about the hepatic flexure, you're thinking the right distal femur. So understand that right-sided, and then understand if it's proximal or if it's distal. Okay, the distal is most likely going to be the hepatic or the splenic, whereas the proximal, it's going to be the sigmoid or the cecum. And so that's a simplified way of actually understanding the Chapman's points. Now, what are Travell's myofascial trigger points? Well, a trigger point is different from a Chapman's points. Okay, trigger points is basically a hypersensitive focus, usually a band of skeletal muscle. It's often painful upon compression, and it can give a characteristic referred pain, and that's one of the common characteristics. To diagnose it, patients usually complain of tightness or soreness in a particular muscle, followed by an injury. And when you palpate, you can see a tightened band within the muscle. Understand that there's referred pain that is reproducible, and it's specific for certain muscles. For example, if there's a tender point within the sternocleidomastoid muscle, it'll refer pain to the occiput and the temporal regions ipsilaterally. And understanding the pathophysiology can give you a more deeper understanding of trigger points. So a trigger point represents the somatic manifestation of a viscerosomatic, somatovisceric, or a somatosomatic reflex. And that's key to understanding its difference from the Chapman's points, which is mainly a viscerosomatic. What happens here is simple. The spinal cord plays an important role, and direct stimuli such as any muscle strain or any posture imbalance can actually start a trigger point. And this concept is very similar to facilitation. Understand also that other stimuli such as visceral dysfunction can facilitate the spinal cord, and also trigger points may facilitate the spinal cord and cause visceral dysfunction. So a trigger point located in the right pectoralis muscle between the 5th and 6th ribs near the sternum has association with supraventricular tachyarrhythmias. And that's a board question that you want to remember. Another board-like question would be a concept where a patient strains his deltoid muscle and again has an overstretched muscle spindle which will sensitize the interneurons at C5. Okay, a reflex occurs so that muscle tension is produced within the deltoid at the initiating site, resulting in a taut band. And if the band refers pain when compressed, then it's considered to be a trigger point. So this recurring theme of referring pain upon compression is something that you should look into on the board review questions and relate it to the trigger points. The treatments for myofascial trigger points are several. You can try a spray and stretch using vapocoolant spray, injection with local anesthetics, muscle energy techniques, myofascial release, ultrasound, reciprocal inhibition, or ischemic compression are also useful. Also keep in mind that trigger points versus tender points are important to distinguish when you're taking the board exam. The biggest difference is that the tender points do not refer pain. Tender points do not refer pain, and you can think of it as being tender, and so they have less pain and they're not going to refer pain. For your memory, just a way to remember it. Also associated with tender points is Dr. Jones, and tender points are small, hypersensitive points in the myofascial tissues. They're similar to trigger points in that they are taut myofascial bands that are painful upon compression. However, the tender points do not refer pain beyond the location compressed, okay? So that's a key thing. These things do not refer pain beyond the location compressed. So on the board exam, if you have Chapman's points, myofascial trigger points, and tender points, again, no referral of pain, you're thinking tender points. If you have viscerosomatic dysfunction and you're trying to treat it, then it's Chapman's points. And again, if there is referred pain and there are manifestations of a painful stimuli, which can be viscerosomatic, somatovisceric, or somatosomatic, then you're thinking myofascial trigger points on the board review questions. Another idea you want to understand is the locations of the common Chapman's points, and please visit COMLEXflashcards.com for additional blog posts about Chapman's points and a diagram on the exact Chapman's points that you may be asked on the board exam by searching COMLEXflashcards.com. Good luck in your preparation for the board exam.